found out we were expecting in early January, and we were very excited because we were looking forward to a second baby. And it was a very normal pregnancy. I was able to work and travel. I felt really quite good up until the last about a week and a half. I came down with like I was having fever and body aches for about a day, 2 days. Once we got to the hospital, we checked in at 8:40, and she was born at 8:58. Yeah, it was like rock star speed. During that time, she had the enterovirus we found out in her lungs, in her spinal fluid. It was systemic. It was all over her body. And she was on a ventilator for a couple days, and she had a lot of supportive care, and they did an amazing job over there, because without that supportive care, she probably wouldn't have survived. Once that kind of improved and everything else turned a corner, her heart looked good, her spinal fluid looked good. We knew that her liver wasn't better, but I don't think you ever want to admit that your child is as sick as they are. At 11:02 that night, Megan, the little PICU nurse, she came in and she tapped me on the shoulder. She's like, "It's the liver coordinator." She goes, "You guys have a liver."
It was a perfect liver, and it was a perfect size. It was exactly what we would want. But her parents, very understandably, were scared and hesitant, because there had been a question amongst all of us of, well, would it recover? And you know, we have lots of different doctors involved, and there's lots of different opinions on, is it going to get better, is it not going to get better?
And Dr. Mercer's like, "Well, I'll just come up." So we came up. It was 1:30, 2 o'clock in the morning. He came up and probably sat with us for a good hour and counseled us on the options and the risks and benefits.
We don't know what the absolute outcome will be. We can't forecast for sure, but we think that she's going to get very sick, and this is our window.
And we had a little angel baby give Gwen a liver, right? Yeah. She'll be 3 months post-transplant on Christmas Day, so she will have gotten her liver off her on Christmas Eve. And coincidentally, September 25th, the day that she was transplanted, was also her original due date. So it's kind of ironic that she got her second life, her true life, when she was supposed to actually be born.
For children to have liver transplants in general is pretty rare in the general population. Then if you say a baby having a liver transplant, well, that becomes sort of rare amongst rare. Then if you take that to the extreme of saying it's not a 3-month-old baby or a 6-month-old baby, it's a brand new 2-week-old baby, that's sort of about as rare as it's going to get. You'll see Gwen in kindergarten in 5 years, and she'll have no idea. She'll, you know, someday someone will say, "Oh, what's that scar on your tummy from?" And she'll say it was something that happened when I was a baby. I don't really know, but my parents do. And so she'll never remember, and they'll never forget.
Every person that we interacted with at Nebraska Medical Center, from phlebotomy to, you know, the doctors, have been amazing, amazing. I mean, they truly live by their motto. They truly do. I think we'll just give a lot of thanks to the gift that we were given for this little liver and this little girl and our new little family. So without a doubt, it'll be a special Christmas.